Morning, folks. Of course, the moment I open my mouth, Lorraine has to take off. Come on. Come here. Come on. Come here. Gentle. Come on, up here. Trying to get up here at a strange angle. She's having a good time playing guard dog. Tail's up in the air, wagging. I'd like to talk with you about some really serious stuff. And I have to be careful because YouTube gives all glory, pomp and glory to the World Health Organization. And it's like, okay, YouTube, your company is around the world, I understand that. But we have laws in this country that allow First Amendment free speech. And so I'm writing again. I don't know why I say that, but I'm dictating, I guess, recording to you so you can understand the causes of mental health and what I consider the biggest fraud in the medical and mental health fields. It's hard to separate them, and you have to remember that we kind of separated the baby and we divided things way too much. So we're not addressing the whole human being very easily. We're not even looking at the whole man very easily anymore. We're looking at just little parts. And the sad thing is when you go to see one specialist, he's looking at one little part and taking care of that, and he might contradict what the other guy's doing on another part, and you can end up with a medical error. Now, it used to be the stable number for medical errors was 400,000 deaths a year due to medical errors. That was back when we had qualified people being selected and we didn't have this diversity and equal outcome. We had fewer seats available in medical school, and you had to have a 4.0, and you weren't given brownie points because you were female or because you were a minority or anything. You had to actually earn your way in and earn your spot in. And it was a serious profession, but it was also pretty seriously fucked up right from the beginning. And one of my physicians, one of my specialists, finally got him to loosen up after about 4 years, and he just started using the F word like you wouldn't believe it. He says, medicine is fucked. The practice is not very good. And I'm not going to go into all the details, but I believe there's certain conflicts of interest. There's also a lot of frauds and lies. And one of the biggest lies, and believe me, I understand this. This is my field. This is my specialty. And I got probably the biggest dog in this fight. And I am pissed. I had some gentlemen on my radio show several years ago, in about 2008, 2009. Dr. Mark Starr, Starr. Unfortunately, he passed away recently. He wrote the book. I think he wrote a book on type 2 diabetes, and he used photos to show pictures of us. And his claim, his assertion was that we didn't have enough iodine, and because of that, we were having diabetes. Now, I don't understand his entire theory or the biomechanics of it, but that's what his claim to fame was. And he was a naturopath that had moved and was working in Scottsdale. A nice fellow. I was hoping to see him professionally, but he passed away. And the other one was Dr. Jerry Tennant, who is alive and well in the Dallas at Fort Worth area, and he practices at the Tennant Institute. And what these two gentlemen told me kind of floored me. And what I got in the lectures floored me even further. So they were telling the truth about what they knew about these diseases and illnesses. And the medical boards don't like the truth out there. You see, this entire medical system is a fraud, and the mental health system too. Just so you know that I'm an equal opportunity hater, if you will, because my profession really has let this country down badly. All of the professions are turned upon the laity. And the sad thing is, they've all been rewarded those high salaries to keep their mouths shut and to bamboozle the rest of us and to really, really not be helpful. So we're going to talk about what mental illness is and the cause and the evidence for their frauds. We have to talk about that. Now, every time you see a brain imaging study in which it's a color picture of the brain and they show you the glucose metabolism, they're showing you the metabolic rates, generally speaking. There's some other things they put in there to track and to test as well. I'm not an imaging specialist, but I will tell you this. Every time they've done those studies and taken those pictures, they have preserve the evidence of the damage they're doing. They claim they're showing you what schizophrenia looks like in the brain. Well, schizophrenia originally meant split diaphragm. It might have meant a soul that was divided, and quite often divided against itself. The German term, schizophrenia, split diaphragm. Right here, the chest, down below, the diaphragm that controls breathing for the lungs. Now, most of these ailments were named by German scientists and German medical doctors and named after the medical doctors. Some of them are actually good contributions, and some of them have been nothing but pits and traps. And what we have in the field of mental illness is we have a whole bunch of discrete diagnoses we can give you. And the problem is, they ain't very discreet. They overlap like you wouldn't believe. And it really just comes down to the practitioner changing his or her perspective a little bit to give you the other diagnosis. It doesn't take much to come up with a lot of different diagnoses. And when you see a lot of diagnoses, you can think, man, that person's pretty screwed up. But you also can think the practitioner is pretty screwed up. So all of that research that these doctorate level researchers, most of the research is done by real doctors, PhDs. Yes, I happen to have one. I earned it just barely by the skin of my teeth. I wasn't the best or the most qualified, but I was tenacious and I wasn't going to give up. And so I submitted myself to the hardest training that was available to me as well. I don't back off from that sort of a thing. And so I actually achieved it. It took me longer than the average person. And I also actually became quite good, but it wasn't because of what they taught me in school. It was because of the work I did after school, in particular, where I read on my own. And there's still so much to learn. There's so much for me to study. I could take classes, but I don't want to step foot on these campuses. I don't feel safe on them. I don't want to teach on them, whatever you say at this point, because, I don't like administrations. Administrations and me have problems, because administrations are authority, and I got a little bit of rebellion in me, okay? But the main thing is that I focused on the clinical. One of my mentors was a psychiatrist, an older fellow, older gentleman, quite a bit older than I was. And he told me, because I was coming up with ideas for clinics and structures and all that, because I'd had some difficulties in the past with the structures of clinics not being very efficient or effective and people getting in each other's ways. And this fellow told me, you have a choice. You can either be administrative or you can be therapeutic. So in other words, you can either focus on your clinical work and the client and the outcome and the patient, or you could focus on the business. You could focus on the administration. You could focus on all of this stuff that doesn't have jack to do with treatment, generally speaking. So with that in mind, I leaned towards treating people, and I actually became pretty good. Not too bad. I'm not sharp anymore. I haven't been practicing for a long time. But my basic concepts and the basic understanding that I have generated standing the test of time. So what Doctors Tennant and Dr. Starr reported to me was about a Dr. White. Easy name to remember, because white guys are always bad. We're discriminated against, so it's easy to remember white men. The discrimination is institutionalized, it's systemic, and it's going to destroy this nation in short order, because y'all can't live without the men. And the men right now just don't give a shit. The women aren't there for us, so why should we be there for them? When you get attacked the next time, baby, you better be armed, and you better be prepared to defend yourself, because we men have had it. You've been attacking us far too much. Not to say you've had an easy ride either, because psychologically this country has worked to screw you over more than the men. They use you to go after us. Most mental health clients are female, and there's a reason for that. I believe women's body chemistry is much more complex than a man's, and it requires more balancing, more care, and it's easier for her to get out of balance. But likewise, her soul, the electromagnetic force field that she surrounds her body by several feet, that's got a little more to it as well. And the sad thing for ladies is that they carry the impressions of every other soul they've had sex with in perpetuity for the rest of their forever. And males just carry it for a year. So it is written in the old literature, the old binary language, in case you're wondering. Yes, computer language from previous civilizations that were greater than our own. And so there's more to a woman than a man, but sadly most of the clients are female. The pictures that they take show you the damage their treatments have done. So those are all evidence of harm inflicted, iatrogenic. In other words, physician caused. The physician prescribed this toxin, this medication, this agent that pretends to be good for you, that sacrifices one part of your body to take care of another part of your body. And usually it's the internal organs that are targeted by these. Thereby they shorten your life. So, my warning to you, if you're on psychiatric medications, do not quit. Taper off. It's best to taper off under the guidance of a physician so that someone's there to look out for you. Because some of these drugs are damn dangerous. And the problem is that when you stop taking the drug, whatever symptom it's targeting, you're likely to experience more of it and more intensely than before. So you will have to adjust, which means you will have to take your time, you will have to exercise, you will have to eat better, you will have to take better care of yourself so that your own body chemistry can come aligned and take charge again. Sadly, the idea that mental illness is caused by chemical imbalances is for the most part a fallacy. Mental treatment causes chemical imbalances, and that's for the most part true. However, some of these drugs are so powerful and so peculiar that I do not recommend going off of them. Not quickly, and I don't have the experience on some of these drugs to predict what would happen in the long run if you stopped. But I do know the most dangerous class happens to be quite effective, and those are the minor tranquilizers. Those are probably the most addictive and hardest to quit. The problem is when you stop your medications, you can have all kinds of horrible side effects, but you can also have side effects while taking them, or main effects is what I prefer to call them, because even though we chart them and claim that this is a side effect, it's so well known we might as well say this is the effect of the drug. it's a main effect. But and the other thing is that when you discontinue a psychiatric medication and you're uneasy or you have withdrawal, symptoms can be anything from visual hallucinations down to physical weird sensations, down to dire depression, and also mania. You can have hypomania and mania. So everything is possible when you withdraw from these things. So be freaking careful. I think if your practitioner's not going to help you withdraw from the medicine, that you need to see another practitioner. But do it under the guidance of a practitioner if you've been on long term. I had a lot of successes getting people off medications and on reduced dosages of medications. But I experienced a couple of failures. We had success going and we had a regression. And one young man, I remember in particular, he was doing so wonderfully. And then he regressed and did some really bizarre stuff and ended up in the hospital. How much of that was under his own volition, heaven only knows. Minor tranquilizers are flat out dangerous because if you discontinue those immediately, it's possible you could go into a coma and die. So with minor tranquilizers, you may have to go into a detox or into substance abuse treatment, quite literally. Or you might have to just go plain slowly, and it'll take you a lot of time, and it probably isn't going to be a lot of fun. So you can taper off a minor tranquilizer in 18 months, 2 years, fairly safely. And then once you do, you'll probably find you can't take that drug, that toxin, that poison again. So you might think, oh man, I'm going to take a little bit to get a good night's sleep, and you find you're wide awake. You may suffer paradoxical effects from it. Your body might just react the opposite. We pretend that these are discrete categories, especially when we talk schizophrenia and bipolar disorders. And we have some harsh personality disorders that are very difficult. They're difficult on other people, and they're difficult on themselves too. And so probably the most notorious is a borderline personality disorder, which is not that different from a bipolar disorder. The difference is that your cycling on a bipolar disorder is much slower over more time. And the cycling, if you will, on a borderline personality disorder is like in the same day. It's a very agonizing kind of a life. And so I have not had a lot of success treating borderlines. They're generally not amenable to treatment, but there are two different subtypes. There's the manipulative, and there is the emotional dysregulation subtypes. And the manipulative, there's, according to Milland, Dr. Milland, there's not much chance of success in therapy because they're manipulative and they've got skills and talents and they don't want to quit or give it up. Well, what I'm trying to get across to you is the point I've never made, and here it is at the end of this video. And so if you've hung with me, you're going to get it. What Dr. Stars and Dr. Tennant told me was that manganese, not magnesium, which you need, and magnesium threonate is the best form for brain health.